Good afternoon, and welcome to episode 2 of Podcast Public Interest. This is Jordan Cooper, your host for today, where we interview politicians, activists, and advocates about the public interest. Today we're here with State Senator Roger Manno from District 19 in Montgomery County, Maryland. Roger Manno has been in the Senate for a little while, originally from New York, and we've just actually been out canvassing in his district, knocking doors today. So, Senator Manno, tell me, why were we knocking doors? What motivates you to get out there, knock on doors, people aren't home, some people tell you to get off their property? Why do you do it? What keeps you going day after day?
Thanks, Jordan. I love being out in the community, just talking to folks about, what's going on in their lives and trying to let them know who their elected officials are and try to figure out what I can do to help. We get our best ideas for legislation from folks at their doors, in their living rooms, in their kitchens, and I get a much better sense of kind of what's going on in the district, the challenges, whether there's transportation or education, how many folks are back in the workforce or still struggling to get back in the workforce, and other problems that they may have. And that's where we sort of get our roadmap when we go into the legislative session as to what we're supposed to be doing. And more than that, I just love knowing that my folks know who to go to if they have a problem.
Now tell me, Roger, do you think this afternoon, were you able to actually talk to any real constituents today?
Yeah, we were talking to folks all day long. We've been talking to folks for weeks.
What were some of the things that they brought up? What mattered to them today?
First and foremost, I think folks were just very surprised to meet their state senator in a year when, I'm not running for re-election. So, and I had a chance to talk to them about some of the issues that are on the ballot this year, whether it's education or, environmental issues, or just the national elections with Hillary Clinton and Donald Trump, and try to make a positive case for why we need to elect Secretary Clinton and Congressman Delaney and Congressman Van Hollen and Senator Jamie Raskin and folks down the ballot.
The whole Democratic slate, it sounds like.
Sure. So I'm out here as a little bit of a emissary for them, and but also, as a state senator, it's important to me and to my office that we know where folks are on issues and what they care about, and that they know who to contact if they need help.
So our listeners, I think, are really going to be interested in hearing about, what if they have an issue, for instance, and their politician comes up to them, they kind of, sometimes it might have happened to some of the listeners, but what I think the listeners want to know is, what's going through the politician's mind? Are you thinking about where you're going to be standing? Do you have literature? How do you even know? Are you hitting every single house? And then, are there any issues that surprise you? What's going through your mind when you're going up to a house? What's your goal here?
My goal is to talk to as many people as possible, and if not, to leave them literature on me and on other folks who are running for office, so that they know where we are on issues and where to contact me specifically if they need assistance, because we're in my state Senate district.
Sure.
But
how does it make you feel?
And you and I were talking about this before. There's nothing more humbling, and that's a good thing as an elected official, than to knock on someone's door who you've never met, and to sort of submit to them. Basically, folks will tell you exactly what they're thinking, and for a lot of issues, if they're state issues, they've got their state senator right in front of them, and so it's very humbling. It's not always a wonderful conversation, but it's always an informative one. And at the end of the day, when I reflect upon the time I spend in people's living rooms or on their front steps talking to them, it's what matters most to me, that they know that I'm at their service. It humbles me every time I do it. And I think it's a really helpful and healthy thing for an elected official to do regularly, and that is to meet folks in their communities and to talk to them on their level about issues that they care most about.
And tell me where you physically put yourself in relation to the voter when you go up to their door.
I usually stand lower than the person.
And why do you do that?
For a couple of reasons. One, because I don't want to make them nervous. If I'm right in front of them at their doorstep, that might make folks a little bit jumpy. But also I recognize and intuitively just believe that as elected officials we're public servants, and we work for the folks who hired us, the voters. And
Who has more power, the politicians or the people?
the people always have the power.
And who works for whom?
The elected officials work for the people.
So you put the people above you, and you put yourself beneath them because you're serving the people. It's almost like a metaphor that you're physically living out every time you knock on a door.
I instinctively do that, and I think that that's an important thing, even metaphorically, for an elected official to always keep in mind that we work for the people. And when we go to Annapolis, it's...
Tell me about that. Have you ever had a time in Annapolis, it's February, it's snowing, it's right before the bill drop deadline, and then you're thinking, are you ever thinking about any particular story? We heard about a lady asking about raw milk, and we heard a lady talking about homeschooling.
Yeah.
Tell me a story about how something that you heard about from an actual constituent, changed your perspective when you were in the state Senate in Annapolis during a session.
There are so many of them. We're not always thinking about every issue that there is. There's thousands of bills that are introduced every year.
Mm-hmm.
But regularly,
Mm-hmm.
I'm reminded of a conversation I had, and I can remember where I was in a cul-de-sac and what the house looked like, and what the person looked like when I was talking to them. That reminds me, I need to keep an eye out for this issue because it affects, whatever community or whatever issue that they were, very, very emotional about. So,
Do you have a particular issue that you were proud of pushing forward in the last few sessions?
Geez, there are so many of them.
I know that healthcare is an issue. You've had a lot of issues personally from your childhood and your later adulthood. Tell me a little bit maybe about what you've done to advance healthcare issues and how you've heard stories from constituents that have actually informed your perspective on healthcare.
So I serve on the Budget Committee, and I serve on the Health and Human Services Subcommittee of the Budget Committee. So all the healthcare funding issues come before us. So whether it's Medicaid issues, folks with disabilities, aging in place, all of these issues go before my subcommittee in terms of funding. So I'm constantly in that orbit in terms of thinking about how to fund those challenges, as I mentioned, aging in place, or adults with disabilities.
You spoke to a guy today about aging in place. Sure. Why did you do that? Why was he interested in that?
He raised it. He raised the issue.
And what was his deal? He was a small business owner?
He actually owned a home healthcare company, a small home healthcare company. I was interested in the work that I did, and I gave him my card, and we talked for probably 10-15 minutes about some of the challenges in home health care and aging in place, and also with regard to addiction services, because he had a family member who's addicted and has had challenges for many years with that. So I don't want to sort of...
It sounds like he was very receptive to you. Like, did he ever meet you before?
No.
So this is his first time.
Right.
He doesn't know you from anyone else.
Right.
You say you're his state senator, but he doesn't know.
Yeah.
And then he just kind of opens up to you. How does that even make you feel? He must trust you, right?
I think most people are sort of caught off guard. They don't really... They've never met a state senator at their door before, so it's a new thing for them, and some people are a little suspicious. You're not really my state senator. But after we get to talking, I think they usually relax and are able to converse with me freely and tell me the things that are of concern to them, the challenges that they're having, what they like about what government's doing, and what we need to improve upon. And that's when it gets good. When the voter is able to either sort of get past whatever emotion they're feeling at that very moment. Some people are very angry when they meet their elected officials, and some people are very pleased.
How do you diffuse those situations?
You just I don't know. I mean, you learn how to listen to people and to try to internalize that without refraining from it. And I think that makes you stronger as an elected official to really absorb that moment with a voter, with a constituent.
So it sounds like a lot of the benefit, it sounds like there's almost two main benefits you're telling me from canvassing. One is reaching out to the constituents and letting them know that their voice can be heard, their voice matters, and here's how you can contact your elected official, and in fact, he's right here in front of you.
Sure.
He cared to get there. The second is that you're actually informing your legislation based upon some of the issues that matter to constituents. So you're finding out what matters to your community, and then you're kind of using that to drive legislation. Would you care to add anything to that, or does that sound kind of accurate?
That is accurate. The best issues that we get for legislation are those. They're just the stories, the tales, the concerns that we hear every day, and they're most accurate when you're learning them directly from folks who
And
you're
hearing about problems, right?
You're hearing about regular, everyday problems that folks face.
And you're able to do solutions. Is that constituent services and casework? Do you get that ever?
Both. We run a very, very busy little constituent service shop. That's the stuff of this job that I actually love the most. The everyday work that we do to try to solve people's problems that you don't really tout, or folks don't hear about.
Now, do you even need to be in leadership to do constituent services?
No, you just
could
need
even
to
be like a freshman legislator to do it, right?
Yeah, but to be good, you need to. There are some sort of some tricks to the trade.
Do you get rewarded? How do you get rewarded for doing constituent services?
You have to love what you're doing. I've been elected 3 times, and
you get rewarded with votes. Does leadership care if you do constituent services?
I think
doesn't really matter.
I think they should. And I think that's what makes you a public servant. The work that we do every day, and the work we do in Annapolis between January and April. But the stuff that I enjoy the most and is most fulfilling to me, and I think is the most relevant as an elected official, is just facilitating and managing that caseload and taking care of people on a day-to-day basis. 8:30 in the morning to 4:30 in the afternoon, and in the evenings in community associations.
Are you on call 24/7?
I am. I mean, my folks have my cell phone number. I work constantly.
Now, why? I'm sure you could make a lot more money doing something else in society. Why are you so passionate about this? What is public service to you? Why do you dedicate your life to serving others? I mean, that isn't something that typically capitalist society rewards. Why are you interested in not pursuing the most and the best for Roger Manno, but really the most and the best for the people of District 19? Why?
I love the work I do. We had some hard knocks, like most people do, early on in my life, and we didn't have health care, and we didn't have a lot of money, and we a lot of tough rolls of the dice happen to us, and I don't think that's unique. I think a lot of people have some tough times, and I wanted to mold public policy, particularly as a lawyer and then as a public servant, because that was the ground zero for the solutions to lifting people out of poverty, to lifting people out of despair. And I've been very, very fortunate, as an attorney and, on Capitol Hill for 3 members of Congress, and as a member of the House of Delegates, and now as a member of the Senate, to learn how to handle casework and to address regular problems of regular people.
Would you say,
just methodically, and it's hard work. It's not glamorous. The casework that we did, and I mentioned this a few minutes ago, is the most important part of this job. It's what I love the most.
So you have almost a greater impact through your casework than you do through your legislative
I think they're both important
capabilities.
But the opportunities to touch people and to change people's lives for the better on a day-to-day basis through the casework that we do, I think is greater than the opportunity to change laws. Although you can change one law that affects 6 million people in 3 months, and we've passed lots and lots of laws.
And you've even passed laws that change the lives of 330 million people, right? When you start passing tough gun laws, marriage equality, ending the death penalty, you're almost like a reference point for the rest of the nation, right?
I mean, I was the issue that matters most to me has always been healthcare reform, and I had a chance, and that's what got me into this business, because we didn't have healthcare when I was a kid and lost my dad. But I had a chance to work with President Obama in the White House on the Affordable Care Act in the early drafts of the bill.
Yeah.
And the thing that I wanted to fix was this, what I call healthcare discrimination, which is pre-existing conditions in these healthcare riders.
And that's gone now.
And we fixed it.
That's awesome.
And so I reflect back on my career and my life and the kind of the hard knocks that we had early on, and to be able to have been a part of that is unbelievable.
I only want to take a few more minutes of everyone's time right here, but you talk about health care. I know earlier this afternoon we talked about there being two constitutional requirements pertaining to the budget. What were those two requirements?
Well, there's really two things that we are constitutionally required to do. We're required to balance the budget every year, which we do every year.
Which, by the way, listeners, 49 states in the United States are constitutionally required to balance their budget. I believe either New Hampshire or Vermont is the only state that is not constitutionally required to balance their budget. However, they do so every year. Of course, the federal government does spend in deficit and print money, so they don't have to balance their budget. Okay. Go on, Senator Manno.
And the other requirement came down by the courts is to provide an adequate and equitable education for every child in the state of Maryland, a free K through 12 education system. More than half our budget is K through 12 education, so we put a lot of emphasis on it. We have great schools in the state of Maryland. They ain't cheap, but it's what we value in the state of Maryland, and in fact, it's required that we do so.
So, listeners, just to let you know, Senator Manno, of course, is talking about Article 8 of the Maryland Constitution, passed in the 1970s, which requires a free and adequate public education for every student in Maryland. Now, here's the question. I want to bring it back to healthcare. What would you think about a similar and analogous constitutional amendment that says universal health care, that every human being in the state of Maryland needs and is guaranteed access to equitable, high-quality health care, a defined benefit package, no carve-outs for any part of your body. It includes optometry, mental, dental, podiatry, and this would be called socialized medicine, just like education.
You know my answer to that.
I'm getting there. Socialized education is public education where all the teachers are employed by the government and they're all funded by taxpayers. This would be the same thing from healthcare, a constitutional amendment to require all to give all Marylanders a basic level of health insurance, and I call it fiscal responsibility through social compassion. So, would you support it, one? And two, do you think as a state we would actually save money?
I support universal single-payer health care on the national level.
Yeah.
I think you can do it on the state level, too. I think that there's
precedent in Vermont.
There is precedent. I think that there's enough flexibility within the Affordable Care Act to actually do it on a state-by-state basis. And look, if you got to step back from the funding piece of this for a minute and ask yourself a question: do people have a right to health care? Do they have a right to live healthy?
It's like a moral question.
And I think most people would agree that we do. And if you do agree that we do, like, do folks have a right to a adequate and equitable education system as we do in Maryland? Yes, we do. How do you get that done? And I believe there's a way to get it done within the current healthcare system, and in terms of the money that's in the system right now, to guarantee that folks have a package of benefits, no matter where they are in life, that's fair, that covers them, that does not discriminate against folks based on pre-existing conditions, or genetic discrimination.
I know you passed a bill about that.
Yeah, we passed legislation in 2008 or 9 prohibiting genetic discrimination, and so I believe that is one of the great civil rights issues of our time, which is to take the insurance companies out of the healthcare business and put them back in the property and casualty business. And there shouldn't be a money person between you and your doctor.
Yeah, but why hasn't the state government or why hasn't the Democratic Party made the argument that this is really a pocketbook issue? That we already have universal health care through EMTALA in 1986, which means if I call 911, I have to go to the hospital regardless of my payer status, even if I'm uninsured, even if I'm undocumented. They don't care about my citizenship status, and I'm getting a $1,200 bill for the ER visit, an $800 bill for the ambulance, put on the taxpayers as uncompensated care with the all-payer rate-setting system from the Health Services Cost Review Commission. Not only that, my premiums are being increased for everybody around the state, and we're driving up healthcare for everybody with cost shifting in very many convoluted ways. We spend more than twice per capita on healthcare in this country than any other nation in the entire world, yet we rank around 40th in the world, 39th according to the 99 World Health Organization study that says we're not getting the best quality of care on a population level. So isn't this a pocketbook issue where if we expand care and give everybody access to a basic level of care, we actually reduce the total cash amount that the society is responsible for?
I think you just answered your own question, and I'm not sure if I could say it better than what you just said. I can tell you a story though.
One last story, and then we'll wrap it up.
When I was a little boy,
Yep.
we didn't have a lot of money.
Yeah.
We didn't have health insurance.
Mm-hmm.
My dad got sick. You walk into the emergency room like thousands and thousands and thousands of Marylanders or Americans because they don't have health insurance. You walk into the emergency
What
room.
happened?
Long story short, dropped dead of a heart attack.
Can you believe
because
that?
He didn't have good care.
Because he was uninsured. He died.
But who had to pay for his care? It was spread across everyone. So all folks who walk into emergency rooms on a regular basis,
Right.
every day, thousands and thousands of them, their care...
Is that right? Is that just? Is that the kind of society you want to be a part of?
No, but their care is built into the cost of everyone's premiums.
Right.
And so what we have is essentially
You're already
a two-tiered
paying for these
system.
uninsured people.
Yeah.
And what's
it
the two
shouldn't be that way.
tiers?
Folks who can afford health care and folks who can't. And it shouldn't be that way. And it's not fair. And there's a way to cover everyone that actually reduces the rate of healthcare particularly in terms of the cost curve. If you look at a graph and, one of the things that we did not do in the Affordable Care Act, which is a work in progress, right, is address the long-term costs of healthcare. And I think in 10 years, when healthcare costs cease to be a poor people issue and become a working class folk family issue, I think you're going to see another major change to healthcare in this country, like we do in many other countries in the world, where healthcare is much more affordable and universal.
So that's Senator Roger Manno with an optimistic view on what healthcare in America could be. Obamacare, the Affordable Care Act of 2010 passed. It's just a starting point, according to Roger Manno, building upon the 1965 Social Security Act amendment under LBJ. That's Roger Manno talking about public service, very passionate, serves his constituents. Thank you, listeners, for another episode, listening to another episode of Public Interest Podcast with Jordan Cooper. Listen next time to further interviews with activists, politicians, advocates, and interesting people who advance the public interest across our country. Thanks so much, and I'll talk to you next time.